Good afternoon to everyone. I am Dr. Harish. I'm a consultant psychiatrist working with psychiatric rehabilitation services. Warm welcome to all of you for today's Road to Recovery program, which we conduct on every fourth Friday. So, as part of today's program, it's a pleasure for me to introduce my colleagues as well as to give an overview of the topic, that is mental health insurance policies, claims, and grievances. I think a lot of people with mental health problems often report or complain about having challenges in purchasing a policy, or even when they purchase in terms of claims, getting the claims processing, reimbursement, if it is a reimbursement policy. So hopefully through this discussion, we will have some more understanding about how can we broaden our knowledge in these areas so that effectively we can use existing health insurance schemes or the products that are available in the market to the advantage of people. So just I'll give a overview that some of you may be aware that Mental Health Care Act has a provision which says that all mental health insurances should be equated, or mental health conditions should be covered on par with physical illnesses, which was not there earlier. So in that way, Mental Health Care Act is instrumental in bringing that mental illness treatment should be covered on par with physical illnesses. So subsequently, IRDA, Insurance Regulatory Authority of India, in 2018 once and in 2022 has issued guidelines to all the insurance companies to ensure that their products are in line with the Mental Health Care Act. And one more thing, that in 2023, Government of India through IRDA has constituted an expert committee to look into any kind of suggestions that can be offered to IRDA to ensure the scope of coverage on par with physical illnesses in line with the Mental Health Care Act. And NIMHANS Director Pratima Murthy, Madam, has chaired that committee, and recommendations have been submitted to the IRDA. So hopefully, whatever that existing some small kind of gaps or discrepancies in the products may get addressed if those recommendations are also are considered. So having said that, I'll just introduce my colleague, Dr. Aarti Jagannathan, who is a faculty of Psychiatric Social Work Department, who is also part of this expert committee, which I just said that, where we work together with eminent persons to give our kind of views on what could be made into better. So, Dr. Aarti Jagannathan will initially talk about overview of health insurance policies, which she, along with her junior colleagues, did as kind of analysis to look at existing situation of policies coverage for mental illness, based on which some of these recommendations have been actually conceptualized. And subsequently, we will have a brief questions to some extent, because again, I will introduce Dr. Somnath, Mr. Somnath, who has gracefully consented, because in spite of his time limitations, he needs to go before 3 o'clock. So we will try to ensure the time limits. If you, any one of you have any kind of questions, while we would encourage you to send it through chat, if time permits in between, we will ask you to ask questions directly. Now, welcome to Arthi, and thank you. Please. Yeah.
Thank you so much, Dr. Harish. And I'm sure that today's program is going to be extremely fruitful and useful to everybody who's joined in. I would like to thank Somnath ji who has consented so graciously to join this. Thank you so much from NIMHANS. And I'd also like to thank Karthik and Abhishek, who have joined us today at NIMHANS for this program. Welcome to all of you. I'm going to be talking about an overview of health policies, specifically to do with their inclusion about mental illness and mental health disorders in their policies. And this was an outcome, as Dr. Hari said, of a deliberation that we had last year, which ended early this year, which we submitted to the IRDA on our recommendations on how mental illness can be included as part of health policies. So this review is up to December 2023. There may have been other products that have come about after that, and we will specifically focus on mental illness. Some of them also cover other intellectual and neurodevelopmental disabilities, but the review was specifically done by my colleagues and my team members for mental illness. So I'm going to share my screen. So to quickly move on, we will be looking at 6 government health insurance schemes. And in this review, we have also looked at the 34 nationalized and private sector health insurance companies, which provide various products. I start with the government health insurance schemes. The first is Ayushman Bharat, which is very well known, which is a national health package, and it was launched in 2018. As per the Pradhan Mantri Jan Arogya Yojana, it basically provides cashless health insurance cover up to 5 lakhs per family per year. However, it only covers inpatient services in government hospitals and only for 15 days post hospitalization follow-up care. Mental illness cover, along with cover for ECTs, RTMS, and other treatments, is available, but it's mainly applicable to those who are registered under the Ayushman Bharat and could be public sector hospitals. The next we talk about is Arogya Sanjeevani policy, which is basically a standard indemnity health insurance. It's about 10 lakhs of sum insured for both individuals as well as floater type, and it covers both allopathy and Ayush. It involves pre and post hospitalization up to 30 days to 60 days, respectively, for the same disease or illness for which hospitalization has occurred, if it is post hospitalization. And it excludes drug and alcohol abuse, but does not mention any mental illness clearly. When I go on to Jan Arogya Bima policy, which is the third one, it covers reimbursements of hospitalization expenses, that's inpatient services, expenses for illness, disease, and injury which is sustained. And there are specific coverages for impairment of persons with intellectual faculties, for treatment of mental illness, stress and psychological disorders, and neurodegenerative disorders. However, it does exclude psychological therapy or counseling. The Universal Health Insurance Scheme, which was launched countrywide in 2003, this is basically for BPL category and for some non-BPL category also. There are specific coverages, again, for intellectual faculties and for treatment of mental illness and cycle. And again, any kind of psychological therapy or counseling is excluded. This is a larger umbrella of the previous Yojana that I spoke about. The Swasthya Sathi scheme, this is specifically in West Bengal. In 2016, it was launched by the government, and it covers all prerequisite illnesses and critical medical illnesses. It does not cover any medical condition which does not require hospitalization. So any condition which requires hospitalization is not taken into consideration. The Rashtriya Swasthya Bima Yojana, which is launched by the Ministry of Labour and Employment, Government of India, it basically targets the unorganized sector belonging to the BPL category and their family members. Smart cards are issued, and it's basically for inpatient healthcare benefits, and depending on the state government's budget and requirement. The total sum insured is rupees 30,000 per family per annum on a family floater basis. Cashless attendance to all covered ailments, and it includes hospital expenses for most common illnesses. Pre-existing diseases also are covered, but however, there's no clear mention of mental illness or psychiatric disorders coverage. I'll move on to the next table, where we have looked at 3 categories of general and health insurance companies, namely the public sector, private sector, and standalone health insurers, that's private sector again, which provide health insurance policies. And all these people are registered under the IRDAI. So a total of 34 companies were reviewed for their health insurance policies as part of the work that we did last year. And only their individual insurance products have been reviewed. We have not looked at group insurance products over here. So the list of companies were basically taken from the annual reports of 2021 to 23 under IRDAI website. I'll briefly go through the entire 34 of them. The first is the National Insurance Company Mediclaim Policy. It talks about inpatient treatment and reimbursement during the policy period. But however, it does not explicitly mention mental health coverage and their inclusion. Oriental Insurance Company Mediclaim Policy. Mediclaim insurance, this is a health insurance cover following hospitalization, domiciliary hospitalization of the insured, and in case of sudden illness in various categories. Again, it does not explicitly mention mental illness coverage for their inclusion. I would like to mention one caveat over here that the discussions that we have had as part of the committee last year, where we did have experts from the insurance sector. And we were told that if any policy does not explicitly mention mental illness coverage, as long as it doesn't exclude mental illness or any other disabilities that we're looking at, it should be considered that it is included. So when I say it does not explicitly mention, that means there is a possibility that they can also be included if a claim is made. I mean, if you register for that. So the next is SBI Health Edge, which is a single comprehensive plan variant. And again, it does not mention mental illness coverage in their inclusion criteria. You have the LIC health insurance. We could not find actually any relevant health insurance plans by LIC apart from the Jeevan Arogya, which also has been withdrawn from 2021. And it also does not explicitly mention mental illness coverage in their inclusion. The ICICI Lombard Health Shield is a complete insurance covering inpatient treatment, pre and post hospitalization. It again does not mention mental illness coverage in their inclusion criteria. The Manipal Sigma Pro Health Prime Insurance, it covers hospitalization, doctor's consultation, laboratory tests, pharmacy makeup for a single portion of healthcare expenses, and it does not mention specifically mental health coverage in their inclusion criteria. Viva Bupa Go Active Plan. This plan covers OPD consultations along with inpatient treatment and intensive unit care pre and post hospitalization. Again, it does not explicitly mention mental health coverage in their inclusion. Care Supreme Health Plan. It aims to expand the healthcare safety net without paying hefty premiums. And it takes care of major healthcare expenses like hospitalization, daycare treatment, and others. It does not explicitly mention illness coverage in their inclusion. Reliance Health Gain Insurance. It has a waiting period for pre-existing conditions and can be reduced from 3 years to 1 year along with other treatment benefits. And it does not explicitly mention mental illness coverage in their inclusion. Tata AIG Medicare, it has a wide variety of health-related expenses ranging from minor to injuries to critical diseases. It again does not explicitly mention mental illness coverage in its inclusion criteria. Navi Health Policy. This is one of the very few policies which explicitly mentions mental illness coverage. This both covers pre and post hospitalization cover along with inpatient care and also OPD coverage. Liberty Health Connect policy. This talks about daycare treatment and other standard inclusions like pre-post hospitalization. It does not explicitly mention mental illness coverage in its inclusion. The Royal Sundaram, it's another policy which takes care of inpatient along with pre-post hospitalization, does not include mental illness in its inclusion. The 10 Platinum Health Insurance, it does not include mental illness in its inclusion, and it again looks at pre-post hospitalization, daycare, and it has a 0 waiting period. And it does not exclude drug abuse and alcohol use. The IFCO Tokyo Individual Health Protector, this covers for pre-post hospitalization expenses and ambulance expenses for critical illnesses. Again, does not explicitly mention mental illness coverage. The Edelweiss Health Insurance Policy covers hospitalization expenses, pre-post hospitalization and standard inclusions. It again does not explicitly mention mental illness coverage in its inclusion category. The Kotak Health Shield, It looks at both early and major stages of cancer, but the policy also provides financial protection against death and permanent disability due to accident, does not mention mental illness coverage in its inclusion. The Chola Health Privilege Plan by the Cholamandalam Group again covers pre and post hospitalization, daycare procedures along with special coverage. And Divyangjan Sanjeevani policy by the National Insurance Company. This is another insurance policy which was recently launched, and it explicitly mentions mental illness coverage in their policy apart from the Navi Bhupa one, which I spoke about. So the Divyangjan one is specifically for people with disabilities, and it's specially designed for health insurance for falling under categories of persons with disability, HIV/AIDS, persons suffering from mental illness, and no pre-policy health checkup is required. The Saksham Swasthya policy by Oriental Insurance again does not explicitly mention mental illness coverage in their inclusion, and it has most of the things like pre-post hospitalization covers, and it does plan to cover 40% or more disability as per the RPWD Act, but does not mention mental illness clearly. The United India Insurance Medicare policy, the plan explicitly mentions mental illness apart from the Divyangjan and the Navi Bhupa policy. This is the third policy which does mention mental illness. Cover for schizophrenia, bipolar, affective disorders, depression, OCD, and psychosis. And it has inclusion criteria like pre-post hospitalization expenses. The Star Mediclassic insurance, it explicitly mentions again mental illness coverage in their inclusion. There's another plan which includes mental illness, and it looks at expenses incurred for treatment of psychiatric and psychosomatic disorders for the first time are covered if the person is hospitalized for 5 consecutive days or more. The Star Mediclassic insurance. Then the Digit Health Care Plus policy again is another policy which explicitly mentions mental illness coverage in their inclusion. Under section B7, it looks at specific psychiatric illnesses like schizophrenia, schizotypal delusional disorders, neurotic stress-related disorders, and unspecified mental disorders with hospitalization requiring prior approval. The Aditya Birla Active Health Plan thing, it explicitly mentions mental illness coverage again and their inclusion criteria. The plan mentions about hospitalization covered and mental illness is if it's clinically significant, authorized especially by the doctors. The HDFC Ergo Health Suraksha Plan is another plan which explicitly mentions mental illness coverage in their inclusion, and it looks at standard inclusions like pre-post hospitalization along with daycare treatment. The Universal Sompo A Plus Health Insurance Plan, it again explicitly mentions mental illness coverage in its inclusion. And it looks at, again, hospitalization for treatment of illness, injury, and daycare. The Magma HDI One Health Plan, again, explicitly mentions mental illness coverage in its inclusion criteria. Psychiatric treatment is covered, along with base covers for inpatient treatment and pre-post hospitalization expenses. The future General DIV health insurance plan again explicitly mentions mental illness coverage in its inclusion criteria. It makes conditions for mental and psychiatric conditions along with other covers. OPD cover is also there for this. The Health Bharosa by Raheja group, it covers all the 21 disabilities mentioned, and also under the MHCA Act, it covers mental illness and it explicitly mentions them. The Bajaj Alliance Individual Health Guard policy again explicitly mentions mental illness coverage. The exclusion criteria explicitly mention mental illness in their exclusion criteria. I'm sorry about this. This is specifically those who exclude mental illness. So Bajaj Alliance specifically excludes mental illness from their purview, including Parkinson's disease. Explicitly mention mental illness in their coverage. The Atmanirbhar Health Policy by New India Assurance. Again, this is a new product that has come in recently, specifically designed for persons with disability and persons with mental illness. Atmanirbhar Health Policy by New India Assurance. You have the Shri Criti Care Insurance by Shriram General Insurance. with explicitly mentions mental illness coverage in their exclusion criteria. So they exclude conditions of mental illness and anxiety disorders, and they don't consider them. The last one that I'll come to is the Reliance Specially Abled Health Scheme. Now, this is specifically for persons with disability and mental illness. There's again a new product that has come in, which looks at including persons with mental illness and disability. So, if we look at a summary of the entire thing, we can see three main categories of policies that are there. One is the policies which do not explicitly mention mental illness coverage in their inclusion, but it can be considered on a case-to-case basis. Policies which explicitly mention mental illness in their coverage, and policies which explicitly exclude mental illness in their coverage, which are two of them. So this is the list of health insurance schemes where mental illness has been included, where people with disabilities have been included. And I would be happy to have a discussion on the same and also share the document to those who require at the end of the presentation. Over to Dr. Harish.
Thank you, Dr. Arti. I think you have covered a lot of information about existing policies. One, from what I understand, is that I think, as you mentioned in the beginning, that the insurance wordings, policy under wordings are crucial. Where if it says that, unless it says that it is excluded, it is deemed to be covered. So if any policy that it does not mention that mental illness is covered, it should be deemed that it is covered. And another thing is that if you look at Mental Health Care Act Section 21, which says that mental illness treatment should be covered on par with physical illnesses. So if somebody is proven to be either before ombudsman or in the court that they're by any chance they are treating it unfairly from compared to physical illness, then usually companies will be forced to pay or cover the expenses. So I think then if you have any questions, I think a couple of questions will take, and then
we'll move on. I think
sorry.
Somnath ji
I
is
think
busy. Yeah.
I will introduce now Somnath sir, and then a couple of young chaps who are working in Dilip and Abhishek and Karthik. I'm sorry, Abhishek Jain and Karthik Somegara, who are working in insurance sector. So they will come after Somnath sir. First, let me introduce Mrs. Somnath Ghosh, who is currently working as insurance ombudsman for Northeast 7 states with an additional charge for Tamil Nadu and Puducherry. So when I just looked at his LinkedIn profile, I saw that he's working as insurance ombudsman for almost 7 to 8 years, before which he also worked as in Magna. And he has a lot of experience, almost like 35, 37 years of experience in the insurance sector. He would like to give you kind of information about how people, when they are having any kind of grievances, when they purchased a policy and when they are not able to get a claim either through reimbursement or claim settlement, how insurance ombudsman system tries to help. What are the policy wordings that policy company has made as a contract when it sold the because insurance is a contract between the company and the purchaser. So insurance ombudsman ensures that the company adheres to the product that it has sold, as well as what are the IRDA guidelines that are updated from time to time. So I welcome Mr. Somnath sir. Please join and share your screen and share your views on what kind of usual grievances that you come across. How would you suggest for people who may have challenges with respect to claim settlement, particularly with regards to mental health problems?
Thanks, doctor, and heartfelt thanks to Nimans for this opportunity. And I really, I don't have any presentation as such. I thought that I share my views, and I'll be happy to answer to any queries that anyone has here. Just one thing which was just as not told in a very exhaustive presentation from Dr. Arti. I'm so nice to see you have done such a research, and in fact some facts also I didn't knew I saw. So you are absolutely right. When you are judging coverage in any insurance product, you have to see the exclusion part only. Whatever is not excluded is covered. Please ensure that. Only so to judge whether I am well covered under the insurance, you have to only go to the exclusion part of the policy. So what you said is absolutely right. I'll just read out for the benefit of members here, because you mostly would be aware also. This circular of the IRDAI, 22nd July 2020, and it's very clear, which has said that following illnesses cannot be excluded in any health insurance except PA and travel policies. Except PA and travel. PA means personal accident. So no health insurance policy shall incorporate the following exclusions in the terms and conditions of the policy contract. So under that, in clause E of that, it mentions treatment of mental illness, stress, or psychological disorders, and neurodegenerative disorders. So IRDA 22nd July 2020, it is a 155-page master circular on health insurance. This is in page 95 of that, chapter 2. Where you will find this, and that has actually formed the basis of the coverage, which all, as you showed, almost every insurer is now bound to cover mental illness. So that is there. Only one caveat I will put in here, because as an ombudsman also, why see issues come up for health insurance, and it is equally applicable for mental health also. At the time, insurance contract is based on the principle of utmost good faith. Please keep that in mind, friends. So at the time of insurance, when you are doing, you are required to fill up a proposal form. Kindly fill up yourself. Do not allow any representative, agent, intermediary, anyone to fill up on your behalf. You should fill up on yourself. Sometimes it has to be filled up physically. Sometimes it is online and OTP based. Either way, the issues which come up to us, sir, we wanted to say, we have told this to the agent. Why he has not put that, we don't know. That will not help you, friends. Please ensure the proposal form is filled up. And when the policy comes to you, if you have any pre-existing illness, like mental illness, if you have, please check whether whatever you have declared in the proposal form is mentioned also in the policy. If not, you will immediately raise a question. As per again the IRDA guidelines, there is a 30 days free look period which you get after issuance of a policy. If every insurer is bound to take note of your objections, even if you find that the policy does not suit you, you can ask for cancellation and you will be given full refund of the premium paid. So these caveat I put, why? Because this is where the problem comes in health insurance, and mental insurance I will consider to be a part of the health insurance thing. Please declare, please be truthful. Don't think because the vision is, if I declare, they will not give me insurance. No, it might be the premiums may get higher. And what happens is that when you declare it, it becomes a pre-existing disease. It is called PED. So for the first 36 months, you will not get a claim on that. You will not get any claim which comes out of that illness. But beyond that, you are free. After that, you are well covered. So I hope I am able to make myself abundantly clear. Please ensure a truthful declaration when you try to procure a policy. Now I am told to explain how this ombudsman system works. Friends, this is, I will say, the most simplest system to say. We at present have almost 5 crores court cases pending, right? Where there are hearings, you have to appoint an advocate to defend. And this is a forum, this is also a forum where the TAT of resolution from the registration of a complaint to the final issuance of the order is 90 days. And there are so many centers, there are 17 ombudsman centers pan India. There are so many centers who are doing it even within 60 days or 45 days also. So just think. And point one. Point number 2 is there is no registration fees, no cost involved in there. Number 3, you do not need to engage any lawyer. In fact, we discourage that. We say no. You will present yourself, because the ombudsman in itself is expected to be an insurance person, insurance knowing person. So he will know you need not fine tune like a law points and all these things. You don't need to know that insurance person, ombudsman, he will know your issue. He will take care of that. So that is very important. And of course, it is a fair judgment. There will be whatever issues. If your case has certain defects, deficiencies, you will be point blank told and advised there and also counseled there. This is where your problem lies. So it is not that the order comes as a surprise. It has been, you are being expressly told what is it, how and where this problem lies. Number 5, this can be entirely, the process can be entirely virtual. From the stage of registration of the complaint to the hearing and even the dispatch of the order, entire thing can be online, and no person has to move, even if he is physically disabled or any problems, senior person or anybody busy. So you can just have the hearing at the comfort of your office or home. So this is how, friends, and also to know, the order passed by the ombudsman needs to be complied by the insurer within a TAT of 30 days. And that order is binding upon the insurer. Of course, the complainant has other avenues, but the order of the insurance ombudsman is binding on the insurer. So in brief, this is how the ombudsman works. Yes, I have also received mental illness complaint cases, and we have accordingly adjudicate also on that. So even if there is an underwriting issue, it is not well covered under your policy. And of course, if there is an issue at the time of claims, you can definitely approach. But the rule is, before you approach, say whatever your issue may be in the issuance of the policy or in the settlement of a claim, you have to first, because every insurance company, as per rule, they have a GRO. GRO is grievance redressal officer. You have to apply to the GRO of the particular insurer with your problem, with your complaint. If you don't receive a satisfactory response, or if he refuses it within 30 days, then you have a 1 year time. You have a 1 year time to approach to the insurance ombudsman. And the insurance ombudsman has a pecuniary limit of rupees 50 lakhs. They can adjudicate up to 50 lakhs of any claim. So the rule goes like this. So first you apply to the GRO. You don't get a reply within 30 days. You are free to approach to the insurance ombudsman. So friends, I think I have been able to, in this short time, been able to express my points. So this is basically the issue I wanted to share. And if there is any question, please feel free to ask. And if you are not aware of, the site of the insurance ombudsman is also called Bima Lokpal. The site is www.cio.ins.co.in. Any complaint can also be lodged to the portal. It can be lodged like that also. It can be through mail, or of course you can walk into any insurance ombudsman office also to lodge a complaint. And every 17 centers are there. Everyone has their typical email IDs. It starts with Bima Lokpal dot the name of this center and @CIOINS.co.in. So every 17 centers, like for Chennai, it is bimalokpal.chennai@CIOINS.co.in. So you will decide on which ombudsman is applicable to your location. So yes, if there is any question, please tell me. I think there is one from Ms. Geeta. Mr.
Hi,
Suresh.
sir. Can I talk?
Yes, please tell me.
Sir, my son is home. He is under the autism spectrum disorder. When we wrote to NEVA, BUPA, and when we wrote to Care Health Insurance, they outright denied that they cannot give insurance policy because he has autism. So what do we do in that case, sir?
Yeah. So it is a case of non-acceptance of the policy.
Yes,
of the
sir.
cover, right?
Yes.
So,
Yes, sir.
again, may I, yeah, you can surely approach to the ombudsman also, but just may I say we have to see exactly the case, why they have done so, because each company will be having their own underwriting principles, and whether they have acted on that or not, we will see. But try to understand also, as per the insurance ombudsman rules, we shall handle complaints from a policy holder, right? So if the policy is not accepted, if the coverage is not accepted and the policy itself is not issued, then you are not a policy holder, right? So
Yes.
in that strictly in that capacity, the ombudsman may not be able to entertain your complaint, but yes, there is a forum under the IRDA, right? Bima Samadhan. So you can definitely approach there, and they may refer to the particular insurer also.
Okay, sir. Thank you. Thank you.
Can I say in line with this only?
Yes.
Yeah,
Yes, sir.
see, same case with me, Niva Bupa, right? They flatly refuse. But there is no evidence, there is no nothing in writing. Once I got in writing, but otherwise, or verbally they say, so how can we go and put up that issue to ombudsman or other bodies? That is one
Sir,
thing.
I will just
Yes,
ask
sir. This
you,
is
sir,
true.
I will
Everyone
just,
tells only over the phone
Yeah,
that they
yeah.
cannot give. They do not give it in writing, even if we
Yeah,
insist.
and there are other issues also I'll share. First, this is very urgent, that's why I talk. So what shall we do?
no, I just wanted to ask you a question, because you both, the earlier speaker, also questioned about the same insurer. Have you
Yeah.
I'm curious to know whether you have approached to any other insurer?
No, since beginning it is only Niva Bupa. Since beginning,
Sir,
almost 10 years.
No,
sir,
so are you saying you are having an existing
Existing,
cover with them,
yeah,
and then
and
they are saying no, and
yeah,
then they're saying no?
they are saying no, they are saying permanent exclusion. And on top of that, once I received an email which I have forwarded to one of our responsible person, and it has mentioned there permanent exclusion, but we have not. Now this meeting is very helpful, very thankful to Dr. Arti. The presentation was very fantastic, all the details of 34. But the only one thing I would like to know, that can you share this, because there are links, there are web links, and they are not visible properly because they are in the red. Secondly, in addition to this, I had a chat some last week in one of the summit with the chairman of IRDA, Mr. Devashish Panda. I told him in front of us that insurance companies are not doing anything. It is only on the paper. Even I told him frankly, and you are saying this claim, this, that, they are not at all been done. So his PA told me that you go to the website. He told me you will find everything. But I am sure there won't be anything because of after Dr. Arti's presentation, it's a very complex thing, and for that I suggestion means if everybody agrees, we like they conduct expos conferences and then forum. Can they conduct all the insurance companies come at one place? Maybe Bangalore city, maybe Mumbai city. I'm from Mumbai, and all the insurance are there, and the people can go and visit that, and one-to-one basis, everything will get exposed. Then that whatever we are saying now, even the chairman said no, they will get really exposed. We should do something. This is a very grave issue, and nobody is bothered about it. Even the politicians, the government, nothing, nobody does this. This is only in talks, nothing
Sir,
else.
sir,
Frankly,
yeah, I think uh, uh, thank you for raising that concern. And as earlier, one other participant, Geeta Madam, also has raised, I think there are two issues. One is that people, companies, when they don't sell products based on the furnished information, I think that can happen for other physical illnesses also. But in such all such cases, as Somnath sir mentioned, that ombudsman may not be the right person because person has not purchased any policy, and people can approach IRDA Bima Samadhan to see how best IRDA can help. The second thing is, once a person purchases a policy, whether it is a permanent exclusion or, in other words, exclusion, if people are excluding and if the purchaser feels that it is unfair, I think Ombudsman is the grievance redressal system. And as Sir has mentioned that now it is completely virtual. People can file the complaint and it should happen within the 90 days. And some centers it is happening in 60 days. And insurance companies are bound to follow the Ombudsman guidelines or kind of whatever the verdict that is given. I think it itself a good information where I think people can use that if they have not used. And we will also take some other questions which people have sent through chat, because I think Sir wants to go before 3 o'clock. Before taking the chat questions, I would request Mr. Vijay Nalawala to unmute and ask questions related to this today's topic.
Right. One question that I had to the ombudsman was, uh, you said any policy holder can raise a grievance, existing policy holder. Now, I have a New India assurance policy, which is a government enterprise, and it does specifically mention mental illness cover. Okay, so it's for the entire family. Now, but it restricts the illnesses covered under the policy. Okay, it's very specific in the terms of which illnesses, and then there are sub clauses. For instance, only during the manic stage of bipolar disorder would coverage be accepted, and so on and so forth. That is one part of it. And the second, I think, which is a bigger violation is, second part is, it restricts claims to mental illness to only 25% of the sum assured. So isn't that also under the purview of the ombudsman then? Because I am a existing policy holder. That is one question that I have. The other question is the the specific policies targeted towards people with disability, they are very highly priced. So in fact, they are exorbitantly priced, and also the cover under these policies is limited to hardly 3 lakh, 5 lakh, which is inadequate in today's times. So these are the two queries that I had.
Okay, sir. Thank you. And I think very pertinent questions. So, to your first question about sublimits, right?
Yes. Yes.
May I mention here, as I quoted the IRDA circular also, where it
Yeah.
directs the insurers that you cannot exclude. But at the same time, please try to understand underwriting. Underwriting is an actuarial job, right? So none, not the IRDA nor the ombudsman can really direct any insurer on the underwriting pricing part, product pricing, and how they will really underwrite it. So that is an exclusive domain of the underwriter. But just I would draw an example, you would know, like for example, Ayush treatments, right? Which was
Right.
also partially insured, like there was a sub limit of 25,000. 25,000. Very recently, IRDA has come up with a fresh guideline which says Ayush treatment, there can be no sub limit, it has to be 100%.
Excellent.
IRDA is trying to make it easier for the customers, for the policyholder. It is a gradual process. Like they receive the feedbacks and they make the changes. So it can happen. As on date, it is not there. It can happen. So many modern treatments were there which were not covered. Now IRDA has listed those which are covered. But at the same time, again, the insurer has the authority put a sublimit there, right? So it may differ from insurer to insurer. But
Sir, is that not a violation?
at least, sir, we have a cover. It is better than we don't have a cover, right?
But
At least we have that.
is that
So that
something we
is
should
one
be
point. And the
satisfied with,
second
sir?
point, huh?
Should we, is that something we should be satisfied with actually? Because when it comes to parity, it is not a parity in that sense. Then there is
Absolutely.
discrimination happening
I
for
agree
people
to you,
with
sir.
mental illness.
I agree to you.
Yeah,
And what I
yeah,
said, that, like
yeah,
that, Ayush was earlier, there was a sub limit. Now it is
yeah.
100%. So things like that will surely move. And because we are seeing lot of changes the past 1 2 years, so surely this will move. But that's how. And as far as your second question goes, where you have
Yeah.
asked for the prices being high, again, that is absolutely outside the purview of the ombudsman, because again this is an underwriting call and the
Correct.
pricing call is that, so they will take on the basis of cost benefit, so it goes like that.
No, I was specifically mentioning about the Divyanjan products, and many public sector insurers. What they are doing is asking policy owners, proposal applicants to go for those products rather than go for the general products which are available. Okay, and that is what makes it too expensive for them to go for such a policy, and then the cover is inadequate. This is what I'm getting at.
Yes,
So
now
then there is no
every,
choice for the family then to
now
apply
there
for a
is every
suitable cover.
company, every insurer is bound to have a base product.
Yeah,
So it is also an IRDA stipulation that everyone has bound to have a base product. You can have the add-ons, so you pay extra cost on that. That's fine. Yeah.
thank you, sir.
Sir, thank you. Just to add on thing, I think as sir was mentioning that it's an evolving thing, and recently I also shared in the beginning that IRDA has constituted an expert committee to look into these things and to give suggestions on bringing how this parity for cover of mental illnesses can happen. That an enhanced director chaired committee has submitted its recommendations, and the changes will continuously ensure that, as you mentioned, that coverage will be on par, because it is also, I think we also should acknowledge that the sublimits do not only exist for mental illness, even for physical illness. Let's say, for example, somebody goes
Yes,
for a
yes.
surgery. So I think that is what usually sometimes kept as a kind of on parity. Uh,
Yeah.
uh, so a few questions that I would like to read for uh,
So much.
Somnath sir is that, sir, can you elaborate on technical terms like adjudication in simpler English? For this is a question from Miss
Yeah,
Ankita.
adjudication is very simple. Like the ombudsman passes an order, we say it's an adjudication. It's
Right.
that all.
So another question is from Miss Prachi Sangvi. If a condition is missed in proposal and the policy is bought, how to update the company about it during renewal or any time before, and will it have any impact on the policy?
Yeah, you should immediately, if you have by wrongly have missed it, I will say immediately you should mail them, because put it on record. People talk over phones. Please put it on record and no WhatsApp chats, please. put it on record by a mail or something like that. And yes, it will be then the prerogative of the insurer, what conditions they impose if they have to include that. It is surely on that. But my entire reason of saying is, at the time of the initiation, please be very careful in filling up the form. Take time, but please do it.
Right, sir. So
Sorry, sir, could I just add
Excuse
my
me, one
question?
more question. If the insurer is if the ombudsman is bribed by the company, can it affect the thing?
Sorry, I
If
didn't.
the insurer, the insurance company bribes the ombudsman, then the case may go against the mentally ill.
I
No.
have got no answer to this really.
I think we will take up relevant questions, sir. Not
Sir, very
personal
important,
experience-based
very
questions.
critical question, if you don't mind. One insurer links clear, sir, please. Only the ombudsman here can answer, if you don't mind. They don't accept clear this thing if the admission is related to suicide attempt. It is very clearly mentioned in the policy, and I think this is very relevant across the table to all the policy holders or those who want to apply. This insurance companies gives a sublimit of 50,000 only for psychiatric disorders. On top of it, this 50,000 is given only if it is proved that the admission is not related to attempted suicide. My question is, suicide is now not, it's decriminalized to the extent it is not, it is more of a symptomatic thing or due to stress and other factors. Being that, why do they put, this is absolutely, I think, a violation of the Act itself. And I don't think they can discriminate like the suicide attempts are not cleared for insurance.
Ma'am, before Somnath sir answers, I think I'll just add up to this. I think one thing that all of the insurance companies before launching their products are usually use the terminology of exclusions given by the IRDA. So in one of the IRDA standard exclusion documents, it has been mentioned that suicide, self-harm injuries can be exempted as a standard exclusion by the companies. Substance use related disorders can be excluded. However, we have challenged in the recent expert committee meeting or this recommendation that these also falls under the mental illness. So we raised that there is a discrepancy in what the standard exclusions which are currently allowed and what is a mental illness as per the existing definitions. So hopefully these also will be addressed in future circulars that IRDA will be issuing. But again, I will request Somnath sir to throw some light on this.
No, fine. You are what you said. My only point, I will not go into case specifics. Suicide, for your information, life insurers, now almost all life insurers do cover suicide. But I think for the first year, for some insurers, it is the first year. For some insurers, it's the first 2 years, they will not cover. After that, they do cover. For life insurers, I'm saying. Right? I'm not saying for health or GI insurers. For life insurers, suicide is now indeed covered. But now, if mental illness is cause of the suicide, then that mental illness should have been mentioned in the proposal form. Again, I come back to that same point. Right?
It is proposed. It is mentioned. Very clearly mentioned that the form was filled up by me. Not that, God forbid, there is no need as such to do anything.
Ma'am, it will be on the specifics of your particular policy. Without that, you cannot make any observations here, madam.
Not just in my policy, but the company policy itself says for anyone, for that matter, if mental illness admission will be accepted by the underwriter only if it is proved it is not due to attempted suicide. So I tried my best to argue with them, even though there was no need, absolutely no need at all till date to claim anything from this company. Still, on behalf of the so many other peers from my side, I know a lot of families from my side who go through this. And because of this, I tried my best, but they said either you take the policy or leave it. This is our company policy. If mental illness, even if it is mentioned there, we will not clear if it is due to attempted suicide. So
Ma'am,
this is
again,
one.
sorry to interrupt you. I think you made your point about that suicide inclusion, that which is right now is not in line with the Mental Health Care Act
Yes.
definition.
The other one more thing, if before he leaves, I don't know if the 18% GST has anything to do with the ombudsman, but in case you can, sir, please convey this 18% GST is absolutely criminal, because most of these policy holders are not having regular employment. They may be employable, but it is employability is not the only consideration. On behalf of many of us present here, I take the liberty, sir, please convey this to the ombudsman, your own IRDA, on behalf of all of us, since we are so blessed by your presence today. We request this as an official. I request you to formally convey this 18% GST. Please walk a mile more and lobby for us to remove 18% GST. I'm struggling for this for the last 5 years.
No, ma'am,
Director Nimans has also.
we have heard you, madam, but actually I'll surely inform, but just to let you know, IRDA doesn't decide on the GST part.
I'm aware of it. Still,
Ma'am, I
one more
think
voice,
that
one
people are
more
waiting for
voice.
questions. Maybe I think
Thank
if
you
you
so
have
much.
any questions, we will share his email ID. Maybe you can reach out to him.
That will be
Yes,
nice.
yes, please do. Please do. I will be
Yeah.
happy to reply.
Yeah. So I think
So any
we'll take
other, so I will
a couple of
have to
questions
take.
last. One Pavan has raised his hand.
I have a question.
Pavan, please, 1 minute. Pavan, ma'am, I request you not to unmute yourself. We will please ask the house. Yes, Pavan, please unmute yourself. Please raise your hand if required.
Mr. Murlidhar, you have raised your hand. Please ask your question to Mrs. Somnath.
Yeah, good afternoon, sir. My brother is suffering from mental illness for a very long time, for more than 35 years. So he's staying indoors all the time. He is unable to move out, and he doesn't have much mobility. So recently we got some of the tests done for him, and we found that the vitamin D levels of my brother has gone down drastically. And the person who did the test, he suggested us to give him some diet, which we are not able to do because he doesn't take that. So what insurance policy covers this aspect, as a consequence of the vitamin deficiency, D level deficiency, and what illness or treatment may be required for him, and which is appropriate health insurance, and which company is offering that?
So that I think Dr. Aarti will be knowing more than me, because I would really not be knowing about what insurer is taking care of what. I'm sorry,
Maybe
I
I think,
don't think.
sir, we are also going to take some more questions which are related to Aarti's presentation and Mr. Abhishek and Karthik's presentation at the end, because you wanted to leave. We are just taking questions which are relevant to you.
Yes.
Ms. Achyuta, she raised her hand. Please unmute and ask question.
Yes, sir. See, as sir had earlier warned that you have to clearly mention in your proposal, and due to some intermediary agent getting my insurance, so my son's condition was missed out. So I have now the insurer has kind of agreed to accept the policy as it is and remove the non-disclosure. But I have been insisting him to kindly include the term disability, autism in the now that it's been disclosed, to include in the document. But they have communicated in the mail not mentioning autism anywhere, but saying that your non-disclosure has been revoked and your policy is valid. Earlier they canceled the policy, but they have now come back and said your policy is valid for your son, and all the other benefits will continue to be valid. But nowhere in the email communication, nowhere in any, they're issuing any revised policy saying autism. So I'm little worried and concerned that somehow they later say that you have not mentioned autism. So I have given him the UDID certificate, disability certificate, but I would be more assured if they mention at least in the email that the non-disclosure of autism has been revoked. They're just saying non-disclosure has been revoked.
Ma'am, what I will suggest here is, as you said, you have sent mails and they have also sent into mails. Please keep copies, if possible, hard copies of those mails, all the mails that you have, right? And just to inform you, since you have declared now, there will be, I think, 3 to 4 years, it depends on the insurer, 3 to 4 years period when you will not be allowed any claim on that particular ailment. So after that, there'll be a claim, but you kindly, even if they say write it or not, whatever correspondences you have made, and they have also replied saying, yes, it's okay there. So please keep those. It will help you.
Right,
Okay.
sir. So, okay, fine. If I can't expect a revised policy document.
You can expect that when the next year policy will be issued. You ensure at that time it is taken care of.
Okay,
right?
Right, sir. Right, sir. Thank
In
you.
the next year, it will be done.
Thank you.
Renewed.
Thank you.
Sir, do you have time to take questions, or shall we wind up with you, sir?
So I think it is. I'll take 2 more questions, right?
Fine, sir.
If
So I
you
think
may.
one person has raised their hand.
Yeah, 2 more questions.
Can we also share your email ID with participants, sir? Because some
Please do,
people
please
still
do.
seems to have some kind of questions and seeking clarifications.
Yes. Only my only request to you, I cannot give my opinion on particular cases, right? Because
Yes,
without
yes.
seeing papers, I can't do that.
Yes.
So, but yeah.
Yes. One, I think.
So can I ask?
Jafar, please ask.
Yes, Mr. Zafar.
Yeah. Hi, sir, and good afternoon to everyone. Sir, my name is Zafar, and we have a policy, floater policy for family with Bajaj Allianz General Health. Okay. The thing is that, sir, I have noticed very recently this year there was some claims in the family, unfortunately, and when a particular ailment there was a good amount of pre and post, they are delaying my pre-posting, saying that document deficiency, and the reason quoting that they follow a mandate that I have to subscribe each and every document of the claim with pen in ink, claim with, say, like their format is Bajic, like claim with Bajic is like Bajaj Alliance, something like that. So, sir, is it really mandatory? Because there are many reports and there are so much of documents that, every document I take a printout, subscribe with it, and do all this. This might be a small question, but I feel a kind of,
No, it's a case of if there is a deliberate attempt to delay the claim, just may I tell you, you can definitely, if their grievance redressal is not able to help you, you can definitely approach to the ombudsman. And just to inform you all also, there is a new mandate from the IRDA now. For an ombudsman order which has not been complied by the insurer during this statutory period of 30 days, they shall have to pay a penalty at the rate of 5,000 per day for every day of default thereafter. Right?
Sir,
so you can take help of that. Whatever you said, if there is a deliberate attempt to not pay the claim or delay the claim, you have the option to approach to the ombudsman applicable
so
to
when
your
case. When you say this nice information you shared, is it with regards to the cashless, or it is with regards to reimbursement?
And not cashless means what? No, you see, settlement of the claim. Because cashless, what they say, they say, I am not very clear, we will settle as a reimbursement claim, right? Please try to understand, cashless is not a final settlement.
Got it. Sir, but here when you use this word deliberate, now this is ambiguous. The thing is that they mention in their in the policy document, and also when we request that how to claim for this and that. So in that process, they mention this process. It is not that there is a deliberate attempt, but the thing is, my concern is that it becomes little cumbersome to follow this protocol, wherein each document I have to subscribe with their. So they mention in the beginning, in the outset, they mention. So there is no deliberate attempt. But if I understand what you're trying to help me, but then it I don't know. I mean, should I dissect this more or should I follow?
Again, you see, yes, I have heard you, but for this particular case now, without seeing the document, and sometimes we need to tag one point with some other point, right? It gets linked. So really, without a inspection of the document, I really can't further elaborate on this. So it's that.
Sure, sir. Thanks
Yeah.
very much.
Yeah.
Sir, thank you.
Sir, I have
Just
a
one question
question.
from my end. We will not take any questions because of the time limit.
Okay.
And sir, just before saying a thank you for you, I just wanted to ask you one more time, because many people are asking about the websites you mentioned where people can actually file a complaint in online mode, or where how they can reach the ombudsman. If the website name, if you can tell it again, that will be helpful.
www.cionins.co.in.
Right. So a lot of thank you from our end, sir. We cannot thank you much.
No.
Yeah,
Please don't thank me. It's my. Please don't
A
thank
lot
me.
of
I feel
information for us, and I think looking at the numbers
I
of
am grateful
participants
for
till
this.
170, it indicates that a lot of people have a lot of interest, and they wanted to learn. Hopefully, they have learned. And we also will edit this today's presentation and we'll upload in the YouTube for people who are asking us whether they can have a PPT or this information that they were not joined. They joined this today's presentation since beginning. This will be uploaded very soon. Thank you very much, sir.
Thank
From
you. Thanks
our
to
end.
all. Thanks to
Thank
all
you
here,
so much, sir,
and
for
we
your
wish
time.
you. Thank you, ma'am, and I wish everyone a good health. It's that all. Thank you. I'll leave. Right.
Thank you. So now I will move on to the third part of the presentation, and I will introduce the speakers, Mr. Abhishek Jain and Karthik Sonegara. Mr. Abhishek Jain is running Bhavishya Safe Financial Services, and he did his business management skills from IIM. And Mr. Karthik Sonegara is founder of startup Insurance Kavach for insurance claim related helping the policy users. So they will have their presentation. Subsequently, we will try to address your questions which are relevant to earlier Dr. Aarti Jagannathan's presentation, and as well as the presentation that Mr. Abhishek and Karthik are going to have. Meanwhile, if you have any questions, we would also encourage you to send the questions through chat, so that we will also take it up with the relevant personnel. Now I am requesting Mr. Karthik and Abhishek to start their sharing views or presentation.
We just request no one to record, because we are recording the session. It will be available on our PRS Psychiatric Rehabilitation Services YouTube channel in a week's time. So I do see that some people have taken screenshots and uploaded PDFs over here. I request people to refrain from doing anything, which will be available on the official NIMHANS PRS YouTube channel. Thank you. Over to you, Karthik and Abhishek.
Thank you. First of all, thank you, Dr. Aarti and the entire team of NIMHANS for having us here, for giving you an insight about simplifying insurance claims and showing you the process on how really this works. Taking things forward, this is, as ma'am said, I'm Abhishek Jain and he's Karthik Sonegara, and we are representing our firm called Insurance Kavach, in which we will be telling you on what is the procedure to take claims. All of us know what is insurance. Most of us don't even know what is the process of taking claims. There are multiple claims, in which one is cashless claim, then there is reimbursement claim. So we'll give you a gist of what this is and what is the procedure to reaching out to the ombudsman. How do you go to the grievances? All that Somnath sir said is a process for taking the insurance claim. We will explain you that in detail. Taking things forward, the first thing that we would want to tell you is, let us understand what exactly is a health insurance policy, what is payable, what is not payable in an insurance policy. Okay, a health insurance policy comes to your rescue in case of any hospitalization happening due to an ailment, injury, disease, or an illness. Under a health insurance policy, mandatory 24 hours of hospitalization is mandatory, but there are few ailments which do not require hospitalization for 24 hours. Say something like a cataract operation, that is also payable under a health insurance plan. Under a health insurance policy, 30 days before hospitalization and 60 days post hospitalization is also payable. Now, what do I mean by this? Say I've got fever today, I go to a doctor, and the first thing that the doctor tells me is to get a diagnostic or a lab test done. I go to the laboratory, I get the test done, I come back to the doctor, then the doctor tells me to get admitted in the hospital. And if I am admitted in the hospital within the next 30 days, all the expenses that we've incurred, so that is the multiple doctor visits, the lab tests that we've undergone, the medicines that I was taking in this period, everything is paid by the insurance company. Once I get admitted in the hospital, then the room rent charges, ICU charges, operation charges, even the medicines that I'm taking there at the hospital, everything is paid by the insurance company. After we get discharged, generally a doctor writes tablets for the next 1.5 to 2 months. They say once in 15, 20 days, you're supposed to come for a follow-up checkup, repeated, physiotherapy, anything as such related to this hospitalization, everything is paid for the next 60 days. Yes, it all depends on company to company. Few companies have say 30 and 60, few say 60 to 180, and few say 90 to 180. Depending on the company to company, pre and post hospitalization can be covered. Under a health insurance policy, anything which is pre-existing while taking the policy has got a waiting period of first 2 to 4 years, depending on the company to company. Now, this is important. Say someone's got a health issue and you're taking a policy today. Yes, it has to be mandatorily disclosed to the insurance company. Once disclosed, the underwriters of the insurance company revert either with a waiting period that this will be covered only after a specific waiting period of 2 years, 3 years, 4 years, depending on the company to company. And they might also come up with a rejection that this person has to be excluded from this policy, or they might come up to you telling that he will be covered with a specific exclusion for a time period or that specific disease. That we need to be very clear in terms of taking a policy to understand what are the terms and conditions, because these are all terms and conditions defined by the insurance company, and it varies from a company to company. Let us understand what is not payable under a health insurance policy. Pregnancy and pregnancy related issues are not payable unless you opt for it or you take an add-on in the policy. In general, it is not covered. Cosmetic surgeries are not covered. Someone's having hair fall, they go for a hair transplant. Someone's wearing specs, they go for lens. All these are cosmetic surgeries. These are not payable. Dental is not payable unless arising due to an injury. So if there is an injury, someone goes for an operation, that is covered, but dental as such is not covered in the policy for root canal and other things. Yeah. Apart from this, anything and everything is covered in a health insurance plan, including COVID-19. So this is generally how an insurance understands your coverage. Insurance companies take your coverage. Now we will guide you on if at all you've had a grievance, if at all your claim has been rejected, if at all you've not got your claim, then what is the procedure? For this, I hand over it further to Karthik Sonigram. Thank you.
Thank you so much, Abhishek ji, for this wonderful overview of what a health insurance policy is and how to go about it. What is an insurance claim? So any kind of hospitalization expense that arises when you are already holding a policy, that time what we do is we ask the insurance company to pay on behalf of us. So that is called as insurance claim in most simple language. So there are multiple reasons of rejection of insurance claim. All this while they have been talking, the prominent reason that we have seen is PED. What is PED? Pre-existing diseases. So when you have not disclosed your PED, when you have not disclosed it in your proposal form or the online based proposal form what you're filling, and when you get a claim arising out of that kind of existing disease, that will be rejected by the insurance company. This is the most prominent reason for rejection of the insurances. There are other rejection reasons. Most of the times when the cashless gets rejected, the insurance company might say that we are not able to ascertain the actual duration, or they might want some further details on the same treatment or the illness. So they'll just ask you to come for the reimbursement with additional information and additional documents. So that is where even the cashless, the prominent reason of cashless rejection is this. All right. And then there are reasons for rejection, like when you have the PED has been declared, but the claim is falling under the same period of waiting period, and still you go for a claim. That again comes under the rejection of the insurance claim. For example, BP and diabetes today. Most of us declare it, and the company has, for example, provided a waiting period of 3 years. So any kind of treatment arising out of hypertension or diabetes or any related diseases for the next 3 years are not covered. So if you are even going for a heart treatment and you have declared BP, the company might say that this is because of BP, and then they will reject it in the first 3 years. So there are a lot of other related diseases along with your PEDs which will not be covered for the first during the waiting period. So that is also a reason of rejection. So as you can read, as of March 2024, the total rejections or repudiations in the country stands at 22,000 crores, and this is when only 7 to 8% of the population holds insurance in the country. So like we spoke about what is insurance claim, and prominently there are two types of insurance claims. One is cashless claim and one is reimbursement claim. Cashless claim is basically where the insurance company will directly be paying it to the hospital on behalf of you, and where you do not have to pay a single penny. There are various ways that you can claim for a cashless claim. One is you can apply for a pre-authorization, where you inform the company in advance that you are going to have so and so surgery or so and so admission, which is a planned surgery, and for that you can take a pre-authorization. One is for emergency admissions, where once you are admitted, immediately you intimate the company and then they process the claim. On the other hand, reimbursement claim is where once the cashless is not approved, or there are times when the hospital is not associated with the insurance company and they do not have a cashless option, you might have to pay to the hospital, and then with all the bills and all your documents, you go to the insurance company and ask for reimbursement, that this is the expenses that has occurred and please refund it back to us. That is reimbursement claim. So what is cashless claim? Okay, so there is one recent regulation by IRDAI which says cashless anywhere. What is cashless anywhere is where IRDAI has made it mandatory for all hospitals to provide cashless claims to all insurance policy holders. And how does this happen? Even if the hospital is a non-network hospital or is not associated with insurance company on a regular basis, in those cases, you have to provide the pre-authorization option only. Otherwise, the cashless will not be available again in those hospitals. If any hospital is any which way associated with the insurance company, you can even apply for the cashless claim immediately when you are getting admitted. But for a non-network hospital, 48 hours prior intimation is mandatory under cashless anywhere option as well. Benefits of cashless claim is simple: no hassle, no tension, no extensive documentation, because the hospital will take care of all the documentation that you have to submit to the insurance company. Like we spoke about reimbursement claim, when cashless is not available, prominently this happens in a non-network hospital, which the IRDA is trying to regulate and bring those changes. But when the cashless is not available in a non-network hospital, we have to go for a reimbursement claim. Customer will pay to the hospital and then apply for reimbursement with the insurance company. Very important point, you have to submit all your documents in original to the insurance company. It includes all your hospitalization bills to all your reports. A detailed document list will be shared in a few minutes in the next slide. In reimbursement claim, we have to make sure that we attend to every query, because there are times, like I told you, that cashless might be rejected for further analysis and for further evaluation of the claim. So that time you have to attend to every query in detail and explain the whole scenario in detail to the insurance company while submitting for the reimbursement claim to make things easier. Right? So this is the list of documents that is mandatory to submit during reimbursement claim. First and foremost, we need an active policy copy, which we need to share. Yes, things are changing and they are making it less paperwork. So policy number is sufficient. Cashless denial letter. When the hospital or the insurance company rejects a cashless claim at a hospital, they will provide you with a letter, maybe physical format or in the email format. You have to submit this cashless denial letter. Along with that, you have to give your detailed complaint letter to the insurance company as to why your claim is still payable. Then comes KYC documents, prominently PAN card, Aadhaar card in today's time. And this is the most important part of the documentation. Claim form Part A and Part B. Part B will be signed and sealed by a hospital to authorize and to authenticate that yes, this hospitalization had happened there and there has been so and so following treatment. So that authentication will be done by the hospital in claim form Part B. Discharge summary of your hospitalization is mandatory to be submitted. All your test reports in originals have to be submitted to the insurance company. All the test report invoices, all your payment receipts. Payment receipts is one thing that usually when we are handling all these cases, payment receipts is one thing where a lot of people miss out on. they think कि हाँ invoice आ गया तो payment receipts का जरूरत नहीं है. Payment receipts is one of the most important document you have to submit to insurance company along with your invoices to authenticate that this invoice have been paid in so and so form. So your payment receipts are authenticating your payment. So that is also very important. Any kind of prescription for tests and medicines or any other prescriptions that the doctor prescribes, that prescriptions are to be attached along with that. Any documents pertaining to pre and post hospitalization also are to be submitted for your reimbursement claim. So if your reimbursement claim is also rejected, then what is the further process? So a lot of companies have 2 or 3 step reimbursement claim process, but otherwise most of them have a single step. So once after your cashless rejection, you go to the reimbursement claim. Reimbursement, when you have submitted, if that is gotten rejected, every company has a grievances cell with them. So this is mandatory as per IRDAI that every company has to have a grievances cell. You will submit your further complaint and with your further detailed complaint letter and everything to the grievances department of the company. All these contacts are openly available on the company's website. So you can reach out to them. So grievances cell has a TAT of 30 days. This is a very important point. Grievances has to respond within 30 days with whatever their decision or the further communication of the claim is, but in 30 days they have to respond. If they do not respond within 30 days, we can directly approach to the insurance ombudsman without waiting further. And if they have responded and if they have still rejected and we still feel that our claim is payable, we can straight up go to the insurance ombudsman. What things you need to take care while approaching grievances cell? Again, a detailed complaint letter. So even if they have rejected the reimbursement, they would have given you a reason of rejection. So countering that with our valid points, we have to attach a reason of reconsideration of the claim, and that is why the detailed complaint letter is very important. Reason why the claim should not be rejected, and the very important point, grievances will reply within 30 days. Like I told, if the grievances rejects it again, or they do not respond within 30 days, the next step to approach is insurance ombudsman, which is also called as Bima Lokpal. Somnath sir has very in-depth explained everything that Bima Lokpal does. The process is very seamless to approach Bima Lokpal. It is very easy. All you need to do is go to their website, register your complaint, and they will reach out to you with further documentation processes. Once that is through, there is two forms that we need to submit to them to giving a consent that they will be mediating between the insurance company and the client, that is us, when we are complaining it to them. So with those forms, further processes that they will provide us with a hearing date, and it is a very seamless process. It is very complaint friendly. I mean, as the consumer friendly process, you need not worry about anything. It barely holds any legal documentation necessary here. So it is a very seamless process. You can reach out to the insurance ombudsman, and we at Insurance Kavach are doing this. We help people in assisting. We assist people in approaching their claims till the whole process necessary. There are a lot of times when people don't know how to reach out. There are a lot of times people are confused as to how to present their case, how to draft their complaints, whom to reach out, which contact number or which email ID are the genuine ones. I have seen on the portal or sometimes on the Google, when we find there's so many fake email IDs which are being shown to reach out to the insurance companies and all that. And a lot of times you don't get your response at all. So we have simplified the whole process and made it even more easier for us to reach out to the grievances department or the insurance ombudsman. So that is how we assist. And for if you are facing any such rejections or any such claims issues, you can anytime reach out to us. Our contact details are there on the screen and you can reach out to us.
So thank you, Karthik and Abhishek, for sharing information related to how people should understand about the claim, that is whether it is cashless claim or whether it is reimbursement, and if people have any what kind of, most importantly, why usually sometimes these claims can get rejected, what kind of documents that they should carry or they should submit in a stipulated time, and if by any chance if a company refuses or rejects, what are the steps that they can take initially by contacting within the company who will be the grievance redressal officer before reaching out further, and then if it is still there are grievances, how they can reach out to the insurance ombudsman. So I think we have few questions which are related to earlier Dr. Arti's presentation and a few questions which are related to your presentation. Before taking something in chat, I think we see some couple of hands raised. Miss Prachi Sangvi, I would
Yes.
request you to unmute and please ask your question.
Thank you, sir. So my question was in two parts. The first part was answered by Somnath sir, but the second part I'm still confused about. I hope the speakers can address it. So Somnath sir says that if a condition is missed, you should immediately inform the company. My second question was, how will it impact the existing policy? Like, will it be cancelled, or like, what is the impact? The second question is already in chat actually, which is the same one. If a condition is developed during the policy period, should it be disclosed at all? Should it be disclosed during the renewal or in between? These are the questions. Thank you.
Answering your question, Ms. Prachi, first point of yours was no, you need not disclose anything once it was during the process of the policy. Once the policy is issued, after that, any disease is coming to a person, then that need not be disclosed. And at the time of claim, the claim will be settled. And one of your query was if you have not disclosed while taking the policy and later you get to know that you should be disclosing that, yes, the insurance company has got the right either to accept it or to reject it, and they will not cancel your existing policy. But if some person is added in the policy with a pre-existing disease, the insurance company's got all the right, either they will accept it or they will accept it with a loading or they will reject it. So this is the authority of the insurance company to come up with a reply to you.
But you do suggest that it needs to be disclosed immediately if the condition is missed.
If
and then the ball is in their court.
No, if it was missed while taking the policy, yes, it has to be disclosed immediately.
Okay.
Yes.
Thank you so much.
Thank you, Abhishek. And we will also, I think, Mr. Jafar has raised his hand. Mr. Jafar, can you ask your question?
Yeah. Hi, sir. And good afternoon to all. I was also following before the talk by Ombudsman sir, so nice to be here. I have a very peculiar but a small case. So what happened is that we had a cashless thing in Apollo in Hyderabad, which is like a network hospital with our insurer. I think that was Bajaj. Now, due to some top-up policy, the thing is that some part of the amount was wholly covered and some part was getting covered by the top-up which we had taken. And but there was a discharge. Say we got admitted on 3rd and 6th was the discharge. So at the time of discharge, we have to settle whatever is the bill remaining. So we settled that and we moved on. But a small amount, though the amount is small, was settled by the Bajaj thing after 2 days. Okay, because of which we have to settle on 6th. So we had to settle whatever was the final thing and move on. But the Bajaj people settled it after 2 days, okay, from the top of amount. Now, when I reached out later to the hospital, they're saying, sir, you have already settled. We have raised you the bill. Talk to the insurer. When I talk to the Bajaj, they say we have already sent that amount, though the amount is small. I'm just quantifying the amount, but just saying there was a lapse or the error. So they say we have sent by NFT. This is the detailed, receipt they have shared it cleanly. When I reach to the hospital, that okay, I'm least bothered about the delay, but can you now refund back that amount because this is the payment they have done? Now they are saying, sir, our account people, and it's Apollo hospital, a genuine hospital. I should have not named the hospital, but just to make it clear. So they are saying, no, sir, we cannot do it. And now almost 1 year is passed, literally more than that. No one has settled this. I reach out to Bajaj, they say, put the claim thing and all, we will look into it. And when I reach out to the hospital in a candid manner, because I know the operation guy, he said, sir, I will look into it. Why are you thinking this thing? Now, if I heard Mr. Ombudsman before this, he also mentioned, and these are not little legal and legal or a little fine thing. He was saying that if there is a deliberate delay, etc., then a fine up to 5,000 rupees per day can be calibrated.
Mr. Jafar, sorry to interrupt you, but can you summarize the process rather than specifically asking an individual concern?
Yeah, so what I'm saying is, in this case, there is a delay for sure. How do I reach out to these people?
Yeah, answering your query, Mr. Zafar, one thing, your amount is payable by the insurance company. It is the prerogative of the insurance company to settle the accounts between the hospital and the insurance company. So you must be sending your final bill and the cash paid receipt to the insurance company with a letter stating that, and the grievances department will settle your claim. If this does not happen, then you can obviously reach out to the ombudsman. And what the ombudsman said is not this delay in which 5,000 rupees will be charged. Once the ombudsman is given an final decision to the insurance company that this amount is now payable to the to say Mr. Zafar, and within the next 30 days the insurance company is supposed to pay it to Zafar. If that does not happen, then it is 5,000 rupees per day, not before that. So the judgment of the ombudsman after that 30 days is what this implies. So coming back to your query, yes, yours is payable. You need to talk to the insurance company, said uh, reach out to the grievances department, give the main bill, and it'll get settled. Should not be a concern.
So thanks. So I reach out to the ombudsman. I just want to add the same thing. Don't mind. It's not a second question. But the thing is that, when the pre-post, as you were explaining the process, and I think because recently we have been having some requirement in the insurance. So the thing is that the Bajaj people in the beginning mentioned that for pre-post, which is reimbursement, they have a process. So they say all the documents should be written with like claim with Bajaj or Bajaj. So,
Zafar,
sir, but
sorry to interrupt you again. I think we will. I think they have shared the email ID also. Maybe if you have any specific concerns,
Reach out to us.
you can reach out to them. We have other people who have raised their hands, who wants to ask questions related to mental health insurance. Sorry to interrupt.
Yeah, so we will, I think we'll restrict to generic questions. If there are specific case related questions, you can reach out to the ombudsman details that have been shared, or to Karthik and Abhishek. They have shared their email ID. So let's please try not get personalized in each of the cases. We have too many questions to answer.
Now I request Mr. Jaidat, who has raised his hand. He's my junior colleague. Jai, please unmute and ask your question to.
I will be brief, sir. No, Namaskar. Thank you for the opportunity, sir. Very good deliberation. I have one doubt, sir. All this insurance related to mental illness has started taking rolling when Honorable High Court at time or Supreme Court has asked the IRDA or those kind of authorities to ensure that at least plotting of the like policies for mental illness should be there at par with physical illness and we have UNCRPD those kind of signatures which also obligated. Now my question specifically is that now intermediately like your companies or foundations has came up which are like specifically or you are developing some kind of package where you are intervening. So I have a larger question that what are the drawbacks if you want to like we are public health institution, we want to help the public or you are the NGO or foundation which you want to run your operationalized cost will be there. You have to hire someone who has a nitty gritty of those things they know. So how to work in the public welfare so that instead of our the client system paying us, who may not be that much, that's why they are coming to the insurance, those things. So whether the as a system, some you see the possibilities that something will be evolved where your technical know-hows can be taken and another then they have some like booklet guidelines.
I got your point, Mr. J. I got your point. You can reach out to us. We can talk about this and things can be taken forward. Thank you. Yeah.
Karthik and Abhishek, I have a few questions I will read out. I think one is from Mr. Hubert, that how are risk factors disclosed in mental health issues and what is loading? What if the diagnosis is not confirmed at the time of admission? What happens if the regarding differential diagnosis or comorbid conditions? What happens if the patient is being treated by 2 or more hospitals for the same illness?
I'll take all the queries one by one. It is on my screen. So the first question is, how are risk factors disclosed in mental health issues and what is loading? What is the disclosure is if somebody is having any mental health issue and if your doctors have confirmed this, a letter from the letterhead from the doctor will suffice, where the insurance company can be submitted and that can be taken into consideration. What is loading? Loading is an additional premium that the insurance company charges. So in general, insurance companies, health insurance premiums are all defined that at this age, this is the premium. So if someone's got any specific health issue, then the insurance company comes up that you'll have to pay a little slightly additional premium that can range from 2% to say 50% also, depending on the company to company. So that is what is loading. Second, the question is, what if the diagnosis is not confirmed at the time of admission? What happens if the redifferential diagnostic or comorbid conditions? Comorbidity conditions, and at the time of taking the policy, if it is not confirmed, then it need not be considered as a pre-existing disease. You can take the policy and go ahead. Future, if something happens, God forbid, then disclosure is any which way not required. So that can be taken care. What happens if the patient is being treated by 2 or more hospitals for the same illness? Absolutely no problem. The insurance company will ask for cashless. They'll settle it with both the companies, with both the hospitals. Or if it is reimbursement, we would want that claim form Part B to be filled by this hospital as well as that hospital. But you need to understand, whatever is the sum insured limit, under that limit, the claim will be settled. Yes.
Thank you, Abhishek. I think there is another question. I think I can take that up. But what is this is about? Are we talking about claims, reimbursement, or cashless for mental health, or generally? As I think, Aarti, please, you want to answer this?
No, I think we're talking about, Karthik and Abhishek spoke about general claims, right? Which also includes mental health. So you generally spoke about the claim process, and also mental illness is included, right?
So mental illness becomes just a part of all the other illness that we are covering. So it comes in the same boat.
I think
queries. I think one Mr. Manoj is raising.
Yeah. Mr. Manoj, can you please unmute and ask? Please avoid stating any hospital name or policy company name. Let it be some kind of generic question if you have anything.
Hi, thank you very much. This has been really educative. In fact, I am considering taking an insurance for my sister. She's been suffering from bipolar for the last 31 years. We've been taking care of her. Now she's 44. So I wanted to understand, can she get insurance which covers both her physical as well as mental ailments? And second, with all the experience that you guys have, can you recommend some insurance policies to me?
Okay. Answering your queries, recommendation, no, not on the official platform. Reach out to us and we might help you with a couple of things. And answering your query on physical and mental illness, see, it completely depends on case to case, depending on the reports. So you'll have to submit the reports to the insurance company, and the insurance company might accept or might accept it with an exclusion of mental, where physical is covered. So it all depends on the reports. Submit the reports to the insurance company and it can be considered.
Okay.
Thank you.
So to just add to on that, I think the Mental Health Care Act categorically says that mental health treatment should be on par with physical illness treatment. So if a person discloses that they have illness at the time of purchasing policy, it will be considered as pre-existing condition. Some companies do cover pre-existing conditions after 2 years, some 3 years, some 4 years. So based on that, I think any person who discloses whatever the mental illness they have, they should be covered. If it is not, then again, it will be kind of seen as violation of the contract, and subsequent steps can be taken as per the previous discussions. So I think that might have addressed Mr. Manoj's question.
I think some questions are there about psychotherapy. I mean, I think in the review of health insurance policies that I had provided, there were one or two insurance policies which did cover therapy. And our recording of today's session will be available on the official NIMANS R2R PRS YouTube channel within a week's time. And you could go through the presentation again to get those details.
Yeah. I don't know the name that I can see only as a human resource. Please, can you unmute and ask a question?
Yes, sir. Good evening. I'm working in a hospital that is a single specialty psychiatric hospital. So we are not getting approval from empanelment from many of the insurance companies. We are giving many attempts, but they are rejecting because it is a single specialty hospital. Most of our patients are already depressed with the patients' attendance and all. So they are facing a difficulty that claiming the reimbursement. To whom should we contact, or if anybody can help with us, so that it will be helpful for our patients too. Thank you.
You can
Ma'am,
reach out to us.
Yeah, I think that actually falls beyond the scope of today's discussion, where we are concerned about people who purchase policies and in terms of claim and grievances. Maybe I think you can reach out separately them if they can help you further. Ms. Achyuta, I think please unmute yourself and ask question.
Yeah, see, when Dr. Aarti had given a list of exclusion hospital and insurance companies. See, some insurance companies have clearly given options for only up to 5 lakhs. Clearly, it is for special disabilities, only up to 5 lakhs. There's Star Gold, and then there is Max Life, and there's one more, Saksham of Care Health. These are given by insurance companies only for disabilities, clearly only for disability up to 5 lakhs. But suppose we are taking with proper disclosure, nobody is giving the regular policy, as Mr. Sir said, or Mr. Abhishek said, they are on par, or Mr. Jagdish said, on par with mental illness. But on par with mental illness, no, like Madam has said, no insurance company is including that, and then some by some loophole saying that it's a fraud or something, their denials and not accepted. So even if you're paying for greater cover, but if they decide that no disability, in spite of being disclosed, they'll say it's not acceptable and all that, because they're offering very clearly, if you have disability, take this, take Saksham, take Nidam or Samnidan, or different things are there in each of the major insurance companies. They have exclusively given policies for special needs.
Yeah, I understand your question, Madam. Thank you for that question. I think as discussed in the initial part of the presentation, we have only reviewed the policies and informed you as to what is available. I do understand that the ideal would be better if the cover is much more, and that's what we have proposed in our IRDAI subcommittee meeting, which we had over a period of last whole year, where we submitted recommendations and said that that policies which cover, it should be on par with physical ailments. Mental ailments also should be given coverage by the insurance agencies. And we hope that the IRDAI will look at the recommendations of the subcommittee that happened last whole year and will implement it soon enough. As of now, what is available is being reviewed and shown to you.
Can I request Mr. BP Ahuja to unmute and ask question?
Yes, thank you very much for giving me a chance. I wanted to ask the details of Kavach team so that I can contact them for buying a policy.
I think they have shared their email ID and contact number, and also we will be uploading the edited version of this presentation where you can
hardly anybody from.
So we can mention it in the chat if needed.
Okay, you can mention it in the chat, no problem.
Yeah, there is one more question. I think these special policies are priced very unaffordable. Consumers are being forced to opt for these type of policies, hoping the expert committee's recommendations are implemented soon. Yeah. Yes, sir. I think we also agree with you. So one more. No, I'll take it. This question. Over. Yeah. Yeah, I think Ms. Achyuta Nadapan has a question related to Niramaya. Please, madam, unmute and ask.
Yeah, this year they have opened the registration online, and they had given a time of 3 to 4 weeks to generate the card. But anyway, I have written to them. They have still not generated the card. It's more than a month. They have not generated the health card. And the second question is, for claims, all the originals have to be submitted. Is it necessary, or like all insurance companies ask for the originals? Normally we need to keep okay.
It's a mandate that originals have to be submitted. You can take a photocopy for your future references, but the insurance company will ask you for the originals.
They are bringing regulations, but mandatory to, as of now, it is mandatory to submit all the originals.
Okay, all right. Thank you. Thank you.
So there is a question from Ankita Jain that Is insurance also covered for service by individual clinics or private psychotherapists?
No. Private clinics are not covered under the mandatory requirement by every insurance company. It has to be a registered hospital, and when I say registered hospital, it is 15 plus beds is what every insurance company considers.
So just to add on, I think the subcommittee that has been constituted where NIMHANS director has chaired, in that we also have submitted a suggestion for the IRDA to consider, because a lot of mental health service users reach out to clinics. Not everybody or most of the people may not go to hospitals for hospitalization. And also because the nature of chronic illness, which might require a long-term follow-up on an OPD basis, therefore to cover them, including rehabilitation, which was not there or not in the earlier things. So we have suggested that not just the therapy or outpatient patient consultations, the rehabilitation for people with mental health problems should also be separately viewed, which sometimes cannot be equated on par with others. And hopefully these recommendations will also shape future product designs, and sometimes it may affect the pricing, but at the same time availability may be there so that people can choose.
Thank you so much, sir.
Miss Archana Sethi, can you unmute and ask?
Yes. Actually, I have a very different question which I had posted also, that what are we talking of? Are we talking of the mental health insurance policies? Because see, in my case, it is my personal experience. Last 1 year, I have been going from here to there to all the hospitals to admit my daughter who has a mental illness. And the doctor has said that she needs to be admitted to monitor the medicines and to administer a higher dose. I could not find a hospital which has a psychiatric ward. The only hospitals are the government hospitals. And like you said, I should not name. So I have, there were 2 or 3 hospitals which have, like Wimhans, I'm sorry, I'm naming it, but they do not cover mental health. The insurance is not covered. So I was at a loss, and the government hospital state is so bad that I could not think of putting my daughter there for this purpose, for administering the medicine. So when we are talking of a mental health insurance, how is it helpful in any case if there is no hospital which is admitting them? So and that's what I was wondering. The first time when she ever got the psychosis, the attack, the first time 15 years back, it was because what followed after the attack, she was admitted as a patient who got fractured and stuff like that. So it was covered. I have an insurance policy last 18 years. So that time it got covered. There were psychiatrists and counselors, because there was the physical side to it also, the surgeries for fracture. So after,
Shall I try to answer, ma'am?
Yes.
Yeah, I think we also need to look at from, for example, let's say I have a health insurance policy where, for example, if I develop heart attack, that will be covered. But what if there is a nearby cardiology hospital? I don't think that it has anything to do with the policy per se wording. And if a hospital which offers services in nearby facility is not available, maybe I have to go to the place where it is offered. I'm not sure how. I don't know whether I have addressed the specific thing that you are asking. And
No.
today's presentation is more related to both in terms of mental illness coverage, process-wise, claims and grievance, and existing policies, how they are covering.
Okay, so you mean to say that I have to go somewhere out of Delhi? I'm staying in the capital of India. So there are no hospitals covering that, the insurance, and there is no mental health insurance.
Maybe Mr. Abhishek, help?
Somebody had asked a question over here about the rehabs and all that. Yes, there are rehabs and some private doctors who are covering, who are giving, they say that you can claim later.
I'd just like to clarify again that rehab centers as well as private psychiatrists are not covered, private clinics are not covered, and that's what we have given as part of our recommendations of the subcommittee of mental health for insurance that happened last year with the director and all of us as members. So we hope that that will get implemented, but as of now, private clinics as well as rehab centers are not covered under insurance. Abhishek, you want to add anything?
No, good.
I think probably, can I intervene, please?
Yes, please.
Because this question is relevant to many families in Delhi.
Quickly, ma'am. Yes, we're running out of time.
Quickly, but on behalf of others. There's nothing to do with me personally. This Rachana's question is relevant to many families. What she's talking about is not private clinics. She's talking about private hospitals. So this needs to be verified. I'm not sure whether, like Fortis Hospital is there, then there is Vedantam and all that. I'm not very sure. Can the insurance coverage people confirm whether these hospital psychiatry beds are covered or not covered? Because they're very relevant information. She's not talking about private clinics, Dr. Aarti.
Ma'am, just for a clarity, Archana ji, you were telling that there is one hospital which is providing treatment there, right?
There are one hospital, like I am talking about Vimhans, but they don't have
Right.
that insurance.
No. So what happens if the insurance, like we told, even the hospital, if it is not even associated with insurance, does your insurance policy cover mental illness?
Yes, I
In
told.
that case, you can go for the reimbursement.
Sorry?
In that case, you can go for reimbursement. Since your insurance policy is covering mental illness and you are getting treated at whatever hospital, if you just fill the claim form and you
I'm
submit
sorry,
it.
the policy doesn't mention the illnesses. I think I'll have to go through it again.
So like Aarti ma'am told in a review, even if it is not explicitly mentioned and excluded, we assume it as included.
I
So
told you that 15 years back, she had the psychotic attack and it was covered by the hospital. It was cashless, in fact, at that point of time itself. But right now, I could not find. I was taking her to the hospitals. I haven't checked on hospitals.
Yeah,
near
so I think, madam, to summarize, one is you may not be able to get cashless if the hospital does not offer insurance for certain ailments, but you can possibly get a reimbursement if you have already disclosed about the illness and got the policy. Then possibly it can be covered if the policy allows. I think that's the answer to the whole.
Yes, ma'am, thank you. I wouldn't be asking if they would have said that you can claim it later. That possibility was also not.
So as the ombudsman said, if you already have an existing policy which does not exclude mental illness, you can reach to the grievances cell of the ombudsman for any of your grievances. And if it is refused, if your claim is refused, you have every right to go to the ombudsman.
Okay, thank you, ma'am. But I'll also check on what Nirmala ma'am has mentioned a few hospitals. I haven't checked on them. I will.
I would request insurance coverage also to check and convey that information to Dr. Aarti. It will be a great help to all of us.
We'll do that.
Suresh, can you unmute and ask if you...
Yeah. Hello. My case is that when I took my son's insurance, I took that time he was working. So it was a corporate insurance. Then afterwards he had a psychotic problem. And that claim I put and they have rejected that. It is some 4 years back, say year 2019 of 20. Huh? So, and they have sent an email also that it is permanent exclusion here. So in that case, can I claim that now?
If it's a permanent exclusion in the policy, you cannot claim.
Yeah.
It very clearly says in the policy that it is not payable. You cannot take a claim.
Okay. So, but now
Payable. If it was included in the policy and if it's a 4-year-old case, yes, you can still claim.
4-year-old case.
What we are saying is the time duration wouldn't matter. Even 4 years later, we can help you or you can still go and apply for the claim provided it is covered. If it is in permanent exclusion, then there's nothing that we can do because the underwriter has clearly mentioned it under permanent exclusion.
But
So
then we are trying to change that now. That
so
guidelines are there, no?
With time, this is
evolving.
Yes.
Might. Because as I said, the chairman said the new guidelines. And which are the new guidelines, I don't know.
They're working on it, so they might come up to us soon.
Sorry to interrupt you. Usually these guidelines will act prospectively, not retrospectively. Or even when circulars do come, they will be in effect prospective thing. And I think a couple of people raised their hands. We will take their questions and we will try to end this today's session because already we are 3:50, I think.
Yes. I
Miss
have a
Geeta, you have raised your hand.
Hi. I'm a parent. My son has autism spectrum disorder. 4 years back, he was admitted for pneumonia and his health claim was rejected because we did not disclose autism at the time of purchasing the policy, which was already addressed. We did not disclose. So what I said was, okay, fine, you don't give me the claim. I'm wrong. It was in 2000. Then I went back in 2000 after 2 years, once he got his UDID card, and I disclosed his condition because they removed his name and only mine and my husband's name was there. Even then they rejected. So I said, if I disclose, you're not rejecting. If I don't disclose also, you're removing his name. What am I supposed to do? So after that, I started running a campaign. I've got around 200 autism parents, but my campaign is more about autism because it's easier to explain to insurance companies that they do not come with comorbidities. So finally, we knocked at the doorstep of many insurance companies. Bajaj Alliance has one product which I would like all parents to hear who can afford. It is called as a
Ma'am, instead of going into the specifics, we will look into the processes rather than going into specifics.
Okay, fine. So what I'm trying to say is all the insurance policies are giving 5 lakhs or less, which is insanely inadequate and insufficient. That one policy I got for my son, which is giving coverage from 3 lakhs to 1 crore. So I bought that not because I recommend it, but more because I do not have any choice. So if any parents are like desperate to get a higher insurance coverage, you can opt for that policy. Otherwise, we need to wait because India is just waking up and insurance coverages are just starting to cover for other illness.
Yeah, I think one of the things that, as you mentioned, that when we had as part of subcommittee discussion, we also learned that as Mr. Somnath mentioned that it works on the principle of utmost faith that people have to disclose at the beginning. So there are some kind of even cases where somebody said that they have not disclosed their bipolar affective disorder. Later, their hernia operation also got rejected on the kind of presumption that they have not disclosed bipolar. So the similar kind of thing that you are mentioning, that when a child's autism was not disclosed, pneumonia was not covered. However, that I think people can raise that as a grievance, and also subsequently they can follow it up with ombudsman, who will actually look into the specifics of the case and whether it is a deliberate attempt to kind of avoid payment or it really falls under the rules of the IRDA regulations kind of thing. That is one. And second thing is, I think all of us, everybody, whoever wants to purchase, they should clearly read the underwriting rather than believing based on others' experiences or based on other suggestions, because ultimately they will have to they will have either the benefits or the consequences of those. So I would urge everybody, if you are going to purchase any kind of policy, please look into the underwriting and then only move ahead. And whenever in your doubt, reach out to experts. If needed, take second or third opinions kind of thing also. That might help you. And we have reached, I think, today's ending presentation.
One question, doctor, please. I have a question, technical question for
This is
NGOs.
last question, please.
Yeah, last question. Thank you so much. Just want to know from the resource persons here, can NGOs take group insurance for its members? I'm talking about mental illness only.
Yes.
Like, is it possible?
Yes,
No,
ma'am.
ma'am.
NGOs, how do we go about it?
Like, let's say we
Aarti ma'am?
No, we are talking about NGOs group insurance, like companies take, you see.
Yeah.
There are quite a few NGOs here in this present session. Suppose we want to take a group insurance for the member families who have persons with mental illness and a treatment, okay? Or the PMIs themselves are members, either the PMIs or their families. Is it possible to approach you for group insurance?
Ma'am, I think this already has been discussed in the past. What we have been told is that as long as people are joining as a group based on some kind of illness category, that itself inflates the risk of the people who are likely to experience such kind of hospitalizations. Therefore, usually companies will not enter into that kind of policies. If it is a illness category group, let's say there is a kind of cancer group who wants to have insurance for them, and
Yes.
companies cannot provide. But it is less like, for example, Jayanagar Association. There are people who are general pool people where there is risky spread. Then I think companies do accept that kind of proposals. But if it is an illness specific group, they will not accommodate that because of the increased risks and costs involved. So
But
that has
this
been
illness, mental illness, there is a right. There is a legislation.
We had a detailed discussion about this in the IRDA subcommittee meeting that we had all through the last year. And
Yes.
it has been informed to us that if it's an illness category, as Dr. Harish said,
They don't-
insurance group insurance are not being provided. This can be contested with the IRDAI further if required, but as of now, it is not considered.
Thank you. Thank you very much.
Thank you, ma'am. So before winding up, I just wanted to thank first Dr. Aarti for considering this topic, which I think a lot of people had a lot of questions. We're looking at the number of participants itself. And I want to thank Abhishek Jain and Karthik and Mr. Somnath, who already has left. And as I said that the edited version of this thing will be uploaded into our YouTube very soon, so that people who have missed some part or who joined late can also listen to this. And every fourth Friday of every month, we will have this kind of art tour where we will choose some kind of topics relevant for mental health care and rehabilitation. I just wanted to ask Aarti for final any kind of
Yeah, I'd like to thank Dr. Harish for chairing the session. He's been my colleague even in the subcommittee where we did a lot of deliberations over the last whole year. Today's was an attempt to possibly bring in some information of the subcommittee that we thought would be useful for caregivers and users. We also are very grateful that Mr. Somnath, the Ombudsman, agreed to be with us and give us information. We thank Abhishek and Karthik. I would like to clarify that Abhishek and Karthik's is a private service of their own, and NIMHANS is not officially associated with them. But since we are aware of the work that they're doing, they have been invited today. So NIMHANS is not officially associated with them, but they have agreed to come in to present with us today. And we thank them from the bottom of our hearts for being a part of this program. And you can watch the rerun of this video on our YouTube PRS channel. Please subscribe to that, and it will be available in a week's time. Thank you so much all for joining us, and we will close the session today. Thank you. Thank you so much.
Thanks a lot.
Thank you so much, ma'am.
Thank you.